At Prisma Health, we are focused on improving the experience of giving and receiving care. We're committed to pursuing new and innovative solutions that will serve our teams and our patients well. To that end, we have partnered with Clemson University to launch the Center for Human Factors Engineering. Human Factors Engineering is a discipline that focuses on how systems work in actual practice, taking into account human capabilities and limitations and tools and technology to ultimately design systems that produce great outcomes in safety, efficiency, and overall experience. At the Center for Human Factors Engineering, Prisma Health and Clemson University will collaborate to conduct pioneering research and to apply human factors engineering principles to the continual redesign of our work. Put simply, this work has the potential to enable us to achieve our goal of improving the experience of giving and receiving care. Through this research and analysis of clinical systems, we can identify opportunities to improve the experience of giving and receiving care. Prisma Health is proud to partner with Clemson University to open the Center for Human Factors Engineering, and we look forward to how these principles can transform the state of health here in South Carolina.
I'm Divya Srinivasan, a professor in industrial and bioengineering at Clemson University.
I'm Rob Morgan. I'm an anesthesiologist and I'm medical director of the Prisma Health Upstate Simulation Center.
Human factors is the scientific discipline that measures and improves the interactions between humans and any systems that they are a part of. In our setting, the system typically refers to the people, the work they do, and the tools and technologies they use to accomplish their tasks. If you look at traditional engineering, they are designing solutions to focus on fixed problems. Those technologies that they design still have to be used by humans, and in that context, what a human is capable of. So HFE is about reframing that conversation of design with the human at the center. We measure and understand human physical and cognitive capabilities as well as limitations and apply that knowledge to improving the design and use of systems and processes in healthcare.
And then we come to a place like this, a simulation center, where we replicate the environment, we bring the same people, and we conduct testing to see exactly what happens. In human factors, we know there's the concept of work as it's envisioned versus work as it's actually performed. So we can watch and see, does the pump work the same way we think it would work when it was being developed in the lab? Or does the workflow process itself work the same way that we expect it to work in the hospitals? By designing a good plan, by creating a good simulation, then we can actually test it, collect data, make changes if needed, and improve outcomes as a result. So human factors engineering takes a step back and allows us to look at these systems and these processes so that we can design them better to fit human capabilities, and in doing so, to be able to reduce errors in the process.
To be specific, HFE would look at the ways information is presented to providers so that it's easily understandable, interpretable, and actionable. We would be looking at improving the usability of the tools and technologies that providers come in contact with. We'd be looking at driving down medical errors by streamlining workflows. And if we are introducing new technologies, we'd be thinking about how can we integrate these into existing workflows. An exoskeleton is an example of a wearable device that could reduce the loads placed on your body while you're doing heavy lifting. While devices like that work ideally in a lab setting, when you bring it into healthcare, simple questions like how long does it take to put on? Will it work if I have to sterilize before getting into a setting? Is it going to get in the way of doorways? These are considerations nobody thinks of when they are making or testing these devices outside the clinical environment. While the system functioning is the core that you want to think about, beyond that, there are numerous other considerations that can't get studied unless we're doing embedded research, and that is the power of looking at HFE embedded in clinical settings.
Endotracheal intubation is one of the most commonly performed procedures in a hospital environment. And yet it's also a difficult skill to master, and it's one that, if performed incorrectly, can result in disastrous outcomes. Using human factors engineering, we can assess both the cognitive side of endotracheal intubation, the psychomotor skill to perform endotracheal intubation, and even the time it takes to perform those procedures. So it's the perfect marriage of human factors engineering with simulation to improve patient outcomes. This is such a unique and innovative approach to solving the problems that we deal with. There aren't many systems in the entire country that are doing this, and only in the last 10 or 20 years have we started looking at human factors principles in the healthcare space. So to bring in engineers, to bring in psychologists and others with that expertise, doing it this way makes complete sense, and we're very excited about this approach.